Good afternoon, ladies and gentlemen. I would like to extend a very, very warm welcome to each and everyone joining us on this platform. Let me start by saying that for over 200 years, vaccines have protected us against diseases that threaten lives and prohibit our development. With their help, we can progress without the burden of diseases like smallpox and polio, which cost brutality, hundreds and millions of lives. In India, adult immunization is yet to become a part of mainstream health conversation. Many adults do not understand the importance of vaccination in their different stages of life. Talking about immunization, ladies and gentlemen, during this World Immunization Week, I, Dwani Karya, on behalf of Z Media, presented by GSK, bring you an enlightening session on the painful disease caused by the varicella zoster virus. Today, we are going to talk about shingles. Ladies and gentlemen, today we are going to talk about shingles. Yes, what it is, its risks and complications, and what preventions one could take. Taking the session forward, I have two very elite set of doctors with us, and it's an honor to have both of them over here. We're starting by introducing Dr. Narayan
কেএফসি বিগ ফিস্ট উইক 40% পর্যন্ত ছাড়।
Banerjee. He is the senior consultant physician at Apollo Multi-Specialty Hospital in Kolkata and the senior consultant physician at Fortis Hospital in Kolkata. He has, ladies and gentlemen, more than 30 years of diverse clinical experience in the field of internal medicine and critical care. He has been a university topper in medicine, including pediatrics. His papers have been published in Apollo Medical and AIIMS in Delhi. Once again, a very, very warm welcome to you, sir. Thank you so much for joining us.
Thank you.
Thank you. Thank you. Next, I would like to introduce Dr. Sachin Verma. He is the Chief Dermatologist and Medical Director of Skin Vita Clinic in Kolkata. His papers have been published in 12 publications in index journals. He has received various awards and accolades in national and international conferences in dermatology, including B.N. Banerjee Gold Medal for Most Innovative Research in Dermatology, International League of Dermatology Scholar, Argentina, Economic Times Award for Inspiring Dermatologist of India, and many, many more. Very, very warm welcome to you, Dr. Sachin Verma. It's an honor to have you.
Thank you so much. Thank you. It's an absolute pleasure to be here with you. Thank you.
Once again, very, very warm welcome to both the doctors. Thank you so much for joining us. And with that, ladies and gentlemen, before moving forward, let me tell you that we have a very, very interesting Q&A segment. That is the question and answer segment post our discussion with the doctors. So I request you to please share your questions and queries on us. So once again, ladies and gentlemen, we're starting with a few questions, and I'll be directing my first question to Dr. Banerjee. Dr. Banerjee, can you please throw some light on what shingles is, and in the post-COVID era, how risky it is for an individual to get this infection?
Yes, shingles is caused by varicella virus, and as we all know, in the childhood, most of us are infected with the varicella virus that is manifested as chickenpox, which may be symptomatic or may be asymptomatic. And this is cured spontaneously, but in most of the cases, this virus remained at the dorsal root ganglia of the nerve as a dormant. But with time, as the age progresses and the body immunity declines, especially cell-mediated immunity, this virus gets activated, and this reactivated virus progresses through the nerve into the different areas of the body with the same dermatome. And it mostly occurs in a patient who is more than 50 years, who is immunocompromised, who is having multiple comorbidities like uncontrolled diabetes, who is having cancer, or who is on chemotherapeutic drug or who is on steroid or who are different patients of arthritis. So this is basically a viral infection which we acquire in the childhood, remain dormant, and become manifested once your cell-mediated immunity is declined.
Thank you so much, Dr. Banerjee, for explaining about this infection. I would like to ask the question to Dr. Verma. Doctor, how common is shingles and who are likely to catch it? And is there a certain age as to when it gets activated and manifested that Dr. Narayan says?
Dr. Banerjee has introduced about shingles very well. I would that forward. I think when we are when we are as a child, chickenpox, and over 90% of who are today 50 years of age have had chickenpox in their childhood. And when you cross 50 years of age, your immunity goes down. And it is this weak immunity that this varicella zoster virus, which is stored in one of the nerves of the body, the dorsal root ganglion of the body, it gets activated and it produces painful blisters or painful vesicles, water filled blisters in the distribution of that nerve. So it can happen in any part of the body. It can happen on face, it can happen on chest, it can happen on back, legs, thighs, anywhere. And people over 50 years of age are actually prone to develop herpes zoster. And usually, 1 in 3 person, that is quite a lot of people. We have about 140 crore people. 1 in 3 person actually develops herpes zoster in their lifetime. So all of us, at least about 30% of people are at risk. But more than immunity and old age, there are other risk factors like you asked. It could be diabetes, it could be any autoimmune disease, it could be HIV, it could be any cardiorespiratory illnesses, respiratory weakness, even COVID. I think in recent times, COVID, post-COVID, we are seeing a lot of herpes zoster activation happening. Anything which can reduce your immunity can actually predispose you to develop herpes zoster.
Thank you so much, Dr. Verma, for putting light that what kind of complications this can create. And continuing the same question, I would like to direct it to Dr. Banerjee. As Dr. Verma suggested, it comes after a latter age, when immunity decreases. So, what kind of complications can one face while getting this disease?
Yes, that is the most important thing because most of the people feel that it is only the dermatological, so there is some blister, rash, and it disappears. So, what is about it? But you should know about three things. One is the pain during the herpes zoster. Sometimes patient they describes the pain as like labor pain. It's more than that of labor pain. Sometimes patient may come into emergency as a cardiac pain. So this pain is excruciating. It may be acute or it may be chronic. And if this pain persists for more than 3 months in the same dermatomal distribution, we call it post-herpetic neuralgia. This is a real serious thing, and around 15% of the patient who had shingles develops post-herpetic neuralgia, and that not only the pain that bothers the patient, it also affects their quality of life, mood, and they develop depression. So this is number one. Number two, sometimes they develop herpes zoster in the distribution of the eye. So that is called herpes zoster ophthalmicus, and that may produce vision loss also. And sometimes this herpes zoster may infiltrate into the nervous system, produces CNS involvement, especially in immunocompromised patient. We have seen lot of disseminated varicella in recent stages where the mortality is pretty high, around 15 to 20% of the patient who are immunocompromised develop disseminated herpes zoster, they expired. So it is a thing, don't take herpes zoster lightly, take home message. prevent singles from the beginning, just to prevent its complication like post-herpetic neuralgia and herpes zoster ophthalmicus.
Thank you, Dr. Banerjee, for taking us to the next question. We're talking about prevention, and you have told us the list of complications that one can face with the disease, and not to take it for granted. So I would now talk about the prevention. We have understood that how dangerous this disease can be, and it can have some really bad effects on the body. But there must be some way to prevent it. So, Dr. Verma, would you like to take this question up and direct us how to prevent the disease?
See, up till now, I have seen many cases of herpes zoster, including herpes zoster ophthalmicus, causing serious problem in vision, even facial palsy for that matter. A lot of people develop facial palsy because of herpes zoster. And, preventing herpes zoster was a big challenge because you would get chickenpox as a child and you don't know when your immunity would be low and when it can get activated, and it all of a sudden it actually develops, causing severe excruciating pain and a problem. And now with I think research coming in, we have herpes zoster vaccines available. So these vaccines, if you take, can actually provide long-term immunity, maybe up to 10 years immunity against herpes zoster. So with the vaccination, I think there is some hope for people who are developing these herpes zoster and the complication associated with it. And the best way, however, would still be that if you can protect yourself from getting chickenpox itself. So being away from people who have chickenpox, taking chickenpox vaccines as a child, and avoiding chickenpox as a disease itself would be the first step. But people like us who have already reached that stage beyond 40, for these people, I think taking the varicella zoster vaccine may be a good idea to prevent the severe, recurrence of or the severe occurrence of herpes zoster and to prevent its complication.
Thank you, Dr. Verma, for talking to us about how to prevent, this disease, and also that what role can vaccine play. So, Dr. Banerjee, would you like to add something to it?
Yeah, I'm telling this herpes zoster vaccine. It's available in India for last 10 years. Initially, it was just a live vaccine. It was marketed. And the problem with the live vaccine that you cannot give to a person who is immunocompromised. And most of the person who develop disseminated herpes zoster or herpes zoster complications, they are elderly immunocompromised patient. And the amount of protectiveness that gives the herpes zoster live vaccine is minimal, especially after the age of 80. So
മാറ്റും ബോളും ചേർന്നില്ലെങ്കിൽ ക്രിക്കറ്റ് എങ്ങനെ കളിക്കുമേ? അതുപോലെയാണ് ഡോക്ടർ ഫിക്സിറ്റിന്റെ LW+ന്റെയും URPയുടെയും ജോഡി. LW+ സിമന്റിൽ ചേർക്കൂ, പിന്നെ URPയുടെ കോട്ടിംഗ് ടെറസിൽ ഉപയോഗിക്കൂ. ഞാനിതാ പറയുന്നു, ഇതില്ലാതെ കംപ്ലീറ്റ് വാട്ടർ പ്രൂഫിംഗ് ആകുകയില്ല. ഡോക്ടർ.
So here comes the research for new vaccine which is safe for immunocompromised patient. Now the recombinant zoster vaccine is available in India also. We can protect our citizen from getting this deadly complication from zoster by giving them vaccine in an early stage.
Thank you, Dr. Banerjee. Thank you so much. Dr. Verma, I would like to ask you that what do you think is the role of caregivers in ensuring adult vaccination?
I think most important part of a caregiver is to recognize the right patient. Recognizing a patient who is 50 years old, recognizing a patient who is immunocompromised for any reason. You may have diabetes, you may have arthritis, you may have chronic diseases like respiratory problems, chronic heart diseases. So these are the patients, or for some reason a very stressed out patient. At 50, if you are stressed out for any reason, that also can actually trigger herpes zoster. So recognizing the patient early on, recognizing your immune compromised patients, recognizing patients who are prone to develop herpes zoster, counseling them, giving them an option that this vaccine can actually protect them for a long time against herpes zoster. And this is also important in families who have already had herpes zoster. You may have, one of the elderly couple out of the two couples who coming to you with serious herpes zoster, having a complication of thalmicus or facial palsy or severe post-herpetic neuralgia. Counseling the other, partner as to giving them adequate care, giving them an option of giving a vaccine, taking care of their family history, seeing that how you can improve their general health, because decreased immunity is actually what triggers to herpes zoster. Counseling and educating them, and if required, vaccinating them at the right time, so that we can prevent them from this disease.
Thank you, Dr. Varma. As we have learned, awareness about shingles and the education of vaccines and to provide it to our loved ones is very, very and very important part of preventing this disease. With that, also let me once again, ladies and gentlemen, remind you that after this very, very interesting discussion, we're going to have a Q&A segment where we will be taking in your questions and directing it to both our doctors so they can guide us better. So you can open your tab, write in and type in your questions, your queries, any doubts you have about shingles, about this disease, and then we can take these questions with our experts over here. Moving forward, Dr. Banerjee, talking about the vaccine, is there any vaccine available for shingles currently?
Yes, it was available also, live vaccine. But the most important breakthrough about this is a recombinant zoster vaccine is now available in India. So we can give this.
Now that's a good news. So, could you also, tell us what is the best treatment for shingles available in India?
So
You're
you
asking me
have to,
or Dr.
I think, to me
Dr.
only.
Banerjee, please go ahead. Please go
Yes.
ahead.
Yes. The best available treatment for singles, I think once you develop singles, you have to detect it early. And there are some antiviral which, if you can give early, can regress the progression of the disease, can reduce the suffering, but it cannot prevent the disease. So I think the best way to early detection and start antiviral at an earliest. Once you develop single, you have to treat with antiviral, and sometimes you may require some analgesics to reduce the pain. But prevention is always better than the cure. So we have to prevent the deadly disease.
Thank you. So prevention is better than cure, and that statement, that very, very important statement, really suits this disease called as shingles, as Dr. Banji has just pointed out. My next question, I would like to direct it to both of you, doctors. I want to ask that some people think of vaccines, because we're talking a lot about vaccines as well, because it plays a crucial role in this disease. Some people think that, of vaccines as foreign bodies being injected in them and they don't even want it. So, what would you say to them?
I think what is important for us to understand, as you started with your statement, that for 200 years, our life expectancy has gone up, our life longevity has gone up. We have saved ourselves from reducing the pediatric mortalities. We have reduced ourselves from various infectious diseases. And lately, even we have reduced so much of mortality because of COVID. It's all because of vaccines. We cannot underplay the importance of a vaccine for any community. I think vaccination is something which leads your body, which actually prepares your body to protect against an organism when it actually attacks you. So vaccination leads to formation of antibodies in the body. And when actual infection happens, these antibodies are well prepared to attack the infection so that the complications of the infection does not happen. So there was a lot of people who actually created this problem even at the time of COVID vaccine, where they did not take vaccination. But ultimately, you realize that most of them now have taken. We have reached more than 200 crore people taking vaccines in India because of COVID. So we have realized that vaccine is the only way to protect against serious infections of the infections which can be prevented. Not all diseases have vaccinations against them, but at least the diseases that have vaccination, I think we should take vaccination against those diseases, take the national protocols, follow the vaccinations where it's available to protect ourselves from serious diseases.
Thank you. Thank you, Dr. Varma. Dr. Banerjee, would you like to add to this?
Now, what I want to say, it needs lot of awareness program about adult immunization. What you were telling very onset, this adult immunization is something which is lacking in our mind, because childhood immunization is taken by the government of India. It is free of cost. But adult immunization against respiratory vaccine, against shingles, against diphtheria, these are very important. And everybody should know about adult vaccination. And if they should take this adult vaccination as per the guidance of the doctor.
Wow, thank you. Thank you so much. That has truly been an invigorating discussion. And now we would like to open this forum to the audience. I guess we received a lot of questions and we'll be taking it one by one. Till then, once again, I would just like to highlight some key points till we get our questions here. That it's very, very important to prevent this disease before it happens, and to make our loved ones educated about it, to aware them, give them clear awareness, clear guidance. One very good example of vaccination has also been polio. It has been a kind of a win-win situation for everybody on this planet, because that again was a very difficult disease to combat. And as doctors have pointed out, that there are very less diseases which have vaccinations for them. So now we'll be moving to the questions. Once again, it's a kind request to the audience to please send in your questions so we can take it. So we'll be starting with the questions now. Received many of them.
কেএফসি বিগ ফেস্ট উইক 40% পর্যন্ত ছাড়।
All right. So your question which says that how long does this disease last, recovery process, and whether it can be fast tracked? I would like to first direct to Dr. Banerjee. Dr. Banerjee, would like to throw some light?
Just repeat the question, please.
Yes. So the person is asking, how long does this disease last, or recovery process of it, and whether it can be fast tracked?
Yeah, usual normal disease process is around 2 to 3 weeks. So recovery process can be fast tracked only by giving antiviral within 48 hours of illness. That is the answer.
Thank you, Dr. Banerjee. I would like to direct this question to Dr. Varma. So the person is asking, what is the pain caused by it? What is the pain caused by shingles?
See, what happens is that the pain that is caused by herpes is called post-herpetic neuralgia. And if I can describe that pain, the pain is very excruciating. It is as bad as a cancer pain, or as bad as a chronic arthritis pain, or as bad as a very, very severe, pain that a person in a scale of 1 to 10, people almost describe it as 9. That is a severe kind of pain these people develop. And this usually happens because of the destruction of the nerves that goes along with herpes zoster. So what happens is the nerve and the nerve membrane, they get destroyed, leading to exposure of the nerve under the skin, giving rise to various sensations, pain, cold, pulling, pain. There is various kinds of sensation people feel in the distribution of that nerve. And the pain can last as much as 6 months to 1 year. There are pains of post-herpetic neuralgia which can last up to 2 years as well. And it is very difficult at times to bring this pain down. The normal painkillers don't work. You have to give something like pregabalin or gabapentin or amitriptyline and strong painkillers, nerve painkillers. And it can disturb the sleep, it can disturb the lifestyle of the person. So it is very, very painful condition. Does not seen in all people, but at least 30 to 40% patients of herpes develop severe pain. So the best way of actually preventing the pain is, as Dr. Banerjee said, starting the treatment of antivirals, whether it's acyclovir, valcyclovir, whatever drug that you want to use, start it early, prevent herpes zoster if possible, give the right painkillers, and aid the recovery, prevent secondary infections and aid the recovery if possible.
Thank you, Dr. Verma. Talking about secondary infections, we have received a question. I would like Dr. Banerjee to take this up. The person is asking, is shingles contagious? Is this disease contagious?
Yeah, that's a very good question because singles, the blister contains varicella virus, and somebody, if who is not immune to the varicella virus, if that is exposed, it is through fomite, it's only spread through fomites. So if he touches that blister and he keep that finger close to his nose, he or she may develop shingles. So in one sense it is contagious, but not so. So it is advisable the person who is having active blister just cover the blister. So it is not as infectious as contagious like chickenpox, but it is definitely infectious.
That is a very, very important point. Thank you so much, Dr. Banerjee, for answering that. Which leads me to another question, which I would like Dr. Verma to answer it. We have received a question saying, is there any possibility of recurring, the disease? Like after curing the disease, can this disease be coming back to us? Can get recurred again?
So mostly herpes zoster happens only in once in lifetime, unless you are extremely immunocompromised. So most of the patients that we see of herpes zoster, they develop herpes zoster in once in lifetime only. Rarely, very rarely, if you are dealing with HIV positive patients or severe immunocompromised patients, patients on chemotherapies. In those cases, a herpes zoster can actually spread all over the body also, which is called a disseminated herpes zoster. It can jump the nerve endings. It can spread to other areas of the body as well. And rarely it can happen for the second time. But usually what we see is happens only once to a person.
Sure. Thank you so much. I would like to direct my next question, Dr. Banerjee. We've received a question which asking that can we treat this disease at home? Can we find some, home remedies for it and treat it at home?
Yes, most of the patients of herpes zoster are treated at home only. What they need proper supportive care during the acute illness, just not to just it begins with the rash, then it crusted. Just making sure it should not be get secondarily infected. And at that time, you give antiviral, some NSAID just to relieve pain. And most of the cases, this pain disappears. But in 30%, 15 to 20% of the cases, pain may persist up to 3 months. When the pain persists for more than 3 months, then we call it post-herpetic neuralgia. So, herpes zoster in a immunocompromised, in a immunocompetent patient should be treated at home only. So the question is whom to admit. The problem is if you have disseminated herpes zoster or herpes zoster in a very, very immunocompromised patient due to cancer chemotherapy or HIV, they may need admission for intravenous therapy, antiviral therapy. Otherwise, you must keep the patient at home, take adequate rest, and other measures.
Thank you, Dr. Banerjee. The next question, of course, I would like to direct it to Dr. Verma. Dr. Verma, we received a question which is asking, I've heard shingles happen to 50 years and above. Please help explain.
See, before I answer that question, I think it can occur at any age. It's not always. Now we are seeing post-COVID very young people also getting herpes zoster. So we should be aware of this as a possibility, and therefore, I believe now that the herpes zoster or the shingles vaccine is now in abroad countries even licensed to be given to young people as well. But I believe in our country it is only allowed for 50 years and above. That is where it is being licensed to in our country. But there are some countries in the world where it is being licensed for 18 years and above. But our country only allows it for 50 years and above. The reason for that is because one is that our immunity goes down when we are old. So that is one of the reasons our immunity weakens up. The second thing that happens is that chronic diseases happen to us in old age. We get diabetes, we get hypertension, we get cardiovascular diseases, stress, and so many things that add up. The third thing that happens at old age is that you may have, uh, you know, uh, unnecessary, or you may be exposed to so many other infections or other diseases, which may weaken your immunity at times. You may be more stressed out, and this can lead to reactivation of the varicella zoster vaccine. So this varicella zoster vaccine, which was sitting quietly in one end of the body, suddenly will get activated when it sees that your immune system is unable to protect it. It travels through the nerve and comes to the area of the distribution of that.
മാറ്റും ബോളും ചേർന്നില്ലെങ്കിൽ ക്രിക്കറ്റ് എങ്ങനെ കളിക്കുമേ? അതുപോലെയാണ് ഡോക്ടർ ഫിക്സിറ്റിന്റെ LW+ന്റെയും URPയുടെയും ജോഡി. LW+ സിമന്റിൽ ചേർക്കൂ, പിന്നെ URPയുടെ കോട്ടിംഗ് ടെറസിൽ ഉപയോഗിക്കൂ. ഞാനിതാ പറയുന്നു, ഇതില്ലാതെ കംപ്ലീറ്റ് വാട്ടർ പ്രൂഫിംഗ് ആകുകയില്ല. ഡോക്ടർ
Distribution of that nerve, leading to an active infection. So basically, after 50, when your immunity is weak, it's like an enemy sitting in your body. When they see that the host immunity is less or the host power is less, it comes and attacks your body. But it is also true that you cannot say that it is not happening in youngsters, especially post-COVID. It's happening to a lot of young people as well. Dr. Banerjee will agree with that. Isn't that, Dr. Banerjee?
Yes, everything, but except the age of the herpes, just this singles
It's 50 years and
vaccination
above.
in all over the country till now it is 50 years, except in US, we EULAR, that is European League Against Rheumatism, they recommends people to give zoster vaccine after the age of 18 before starting immunotherapy or chemotherapy or immunosuppressive therapy. But that is
Right.
not US FDA approved till now. So till now, worldwide, it is only 50 years and 50 years and above. But work is going on. There are a lot of uh, uh, different studies are going on to prevent this disease in early stage.
So, Dr. Banerjee, we have received a very similar question to this answer. We've received that do kids get infected by shingles? Because we're talking about age groups here who gets affected. So, are children also more getting more affected with this, or they're more prone to getting affected with this disease?
See, what happens to children is that their immune system is very strong,
Yes.
and most of them are infected either symptomatically or asymptomatically by chickenpox, or they get vaccinated against chickenpox. So it is very unlikely that child gets zoster.
Right.
Okay.
Yes. Thank you. Thank you, Dr. Banerjee. Dr. Verma, we received a question which is asking that, is there any remedy, that can be treated at home? Like, do we need a doctor when the disease happens, and this person, the person who's got the disease can be treated at home without a doctor?
I think Dr. Banerjee has already answered that question, that it can be treated at home. But I believe that a doctor consultation is necessary. The reason being that herpes zoster has complications, potential complications. It can lead to blindness, it can lead to facial palsy, it can lead to long-term post-herpetic neuralgias, it can lead to secondary infections, it can lead to encephalitis, it can lead to a lot of complications. Consulting a doctor can actually recognize these complications early and prevent it from happening. So consulting a doctor in herpes zoster, even if it means just a visit and he may give the same medication what you are taking, may be a very good idea to prevent somebody from getting complication to herpes zoster. And moreover, I think if you start the medication early, within 24 to 48 hours, the antiviral drugs, you can actually prevent complications and have heal the disease faster. The viral shedding can go down. So it is very helpful that you consult the doctor, though it can be treated at home itself after that.
Thank you. Thank you. So the person who's asked this question, please make sure you do visit a doctor. If somebody, gets this disease, it's always recommended to visit a doctor and then, continue with your home remedy if it's suggested by the doctor, that is. Dr. Banerjee, I would like to direct this question to you. Um, which body parts get infected with this disease? Are there any particular body parts that get infected with this disease?
See, this virus goes through nerves. So it is the common is the thoracic vertebra. This is the thoracic dermatome. So it is the anterior chest wall which gets involved most frequently. Then it is cervical, then it is lumbar. So it is the dermatomal distribution, and the commonest is the thoracic. That means the anterior chest wall gets involved with the blisters.
Thank you. Thank you so much. So, as the person has asked, this disease is not only, attaining or getting affected to one body part. It is a gradual process, right? Yes. Moving forward, Dr. Varma, we have received a question. It is asking that does it happen on face or on the back of a person, and does it leave scars? Will I need laser surgery to make my skin smooth again?
I think that's an interesting question. Any viral infection on the skin which leads to, viral shedding and destruction of the epidermal cells, depending on the type of the or the severity of the infection, you can have scarring seen. Herpes zoster commonly scar. We have seen that whether herpes zoster is happening on the body or on the legs or on the face, the back, since it involves the nerves and nerves are situated all over the body, it can happen any part of the body, including the face. The scars that typically happens on the body to some person who is either a model or a film star or into some show causing business, even the body scars are not acceptable. But most of the general public, if herpes zoster happens on face, then the face scars can look very, very ugly. And therefore we always recommend consulting a doctor, starting antivirals early to prevent or reduce whatever scarring that can happen. But even if you do that, even if you start antiviral early, even if you have treated it appropriately, a lot of herpes zoster is known to scar. And once it scars, then you have to give 6 weeks to 8 weeks for the scar to remodify itself and see how your body reacts to a scar. And most people, the scar tends to reduce on its own in about 6 to 8 weeks time. But after 2 months, if the scar does not fade off, then there are various treatments available. There are chemical peels, there are lasers, there are carbon dioxide lasers. There are various treatments available which can be done to reduce these scars. And it requires multiple sessions, 4 to 6 sessions once every month. And we regularly do, CO2 fractional lasers for herpes zoster scars on the face. And the scars can be improved to a great extent over 3 to 4 months post herpes zoster.
Thank you, Dr. Varma, for taking up this very, very important concern as well. Dr. Banerjee, we've received a question which is asking, do indulgent habits and sedentary lifestyle increase the risk of this very painful disease?
Please
Yes.
repeat.
Do indulgent habits and sedentary lifestyle increase risk of this painful disease?
Yes, you must know how to improve our immune system. There is no food, nothing, but only thing which can improve our immune system is the physical activity, walking. So definitely sedentary habit will decrease the immune system. So I think the basic thing everybody should go from this, from today's message is that change your lifestyle. Take less amount of junk food, more of fruits, fibers, less carbohydrate, and avoid sedentary work. Stop smoking, stop taking alcohol, and walk for half an hour per day. That will increase your immunity to some extent. That will prevent the other disease also.
Thank you, Dr. Banerjee. Dr. Verma, would you like to add to this very, very important point? What lifestyle alterations can be done to combat this disease, or at least try and reduce, the effect, or maybe if it ever can be affected?
I think yoga and exercise can be added to this list. Doing a proper exercise, having a yoga, having a good lifestyle. These days, the entire circle of life or the systems of life are changing. Sleeping in good time, getting up at good time, exercise, yoga. These can be added to, and a balanced diet. That is very important. This can be added to the points that Dr. Banerjee has already covered. Having a good lifestyle is important, and maintaining a good hygiene. That is again very important. Washing your hands, taking good care of your hygiene, not exposing yourself to unnecessary infections, wearing mask whenever it's necessary when you are in infected zone. So keeping a good hygiene and health is equally important beside what Dr. Banerjee has said.
Thank you. That would answer the next question also that we have received. That is poor hygiene responsible for getting shingles? And I guess Dr. Verma has directed us to that, right? That washing hands and other things that you mentioned are very, very important. So let's see if there are any other questions that's coming in. Also, all the lifestyle changes that has been mentioned, our audience, it's a kind request to note that down, especially the young people, because this is disease that now most of the people are getting post 50. So it's good if you take care of your immune system, if you work towards it. Try and eat healthy food, try and maintain hygiene, as Dr. Banerjee and Dr. Verma has suggested. So I guess with that, received all the questions. uh, yes, is there any other questions that's coming in? All right. Just take a 30-second off and see if there are any questions coming in. If there is any other question that you would like to ask us, please note them down right now so we can take it up with the doctors as they're giving their very, very valuable time to us. Yes, we have received a question which I would like Dr. Banerjee to answer. Um, this is very helpful. However, how can I convince my parents for the same?
Yes, that needs actually real. This is a real good question, because for us to convince a patient getting this needle stick for this what they feel that is simple disease. So you have to explain them that, see, you have to take two injections 2 to 6 months apart to prevent this deadly complication from this disease. So you have to convince by whatever means. What I want to say, how I convince my patient is that I know this is a costly vaccine. I know only 15% gets this type of deadly complication, but you may be within that 15%. Nobody knows. So you better you take it, and that's the way I convince. And your parents will first deny, then I think eventually, if you they will also feel that it is only good for her or him that you are telling the same thing repeatedly.
Thank you, Dr. Banerjee, for answering it. Dr. Verma, we would like you to take the next question, which is, what are some valid questions that I can ask my doctor about shingles?
Sorry,
What
please come up
should I,
again.
yes, what should I ask my doctor about shingles?
I think we have already answered that question in the entire 40-45 minutes, that how it appears, what are the complications, what age it appears, am I predisposed. I think these questions have already been answered, and uh, I, these are the questions that you must ask your doctor as to when can I get it, what is the condition that is predisposing me, am I predisposed. Lot of people, the other problem is that a lot of people actually forget that they have had chickenpox in their childhood, and they say, I never had chickenpox in my childhood, and they say, though I have no risk of having shingles. One must understand that over 90% of people, and when you are very very young, maybe 50 years back, you would have had mild chickenpox, or your parents may not be aware, or you may not be aware that you've had chickenpox. That most of us, because chickenpox vaccine was not available at that time, most of us, more over 90% of people have been exposed to chickenpox as a child. So taking that as a factor, and asking the doctor about relevant questions is the way forward.
Definitely, that's a very valid point. Thank you. Dr. Banerjee, we received another interesting question, which I would also like to ask. Why do people don't talk about it openly about shingles? Like they talk about chickenpox. Is it a taboo? Like, for example, when I was given, this discussion and the points of it, and then they had told me that this is discussion on shingles, and I was also wondering what is shingles. Thanks to this, webinar, I came to know that it is about this very, very grave disease. So, is this a taboo that people are not talking about? This very important disease. What is it?
This is lack of awareness, because we know chickenpox is a very contagious. So if you have chickenpox, you don't go to that house. That we all know. But
Yes,
here the awareness is lacking. There is some blister in the body, presupposed that it is chickenpox. That is the first symptom. Now, everybody except those who are having continuous pain, they used to ignore this. And it is not as infectious as chickenpox. So I think there is no taboo, there is lack of awareness.
definitely. There's lack of awareness. Thank you, Dr. Banerjee, for asking us.
I would like to
Also,
add something here.
yes, please.
I think the other problem is that the word herpes zoster, that is a name associated with it. A lot of people contribute this to a sexually transmitted diseases, because they think herpes means it's sexually transmitted, and that is where the actual misconception or the taboo comes in. This herpes is not the same as herpes simplex, which could be sexually transmitted. So that differentiation is has to be explained to the patient. A lot of these patients don't want to say herpes zoster as a taboo, because they think if I say herpes, they will think I am suffering with a sexually transmitted disease. And that differentiation is important. The word herpes means group lesions. And group lesions are seen both in herpes simplex, which is sexually transmitted, and herpes zoster, which is caused by chickenpox virus. So this differentiation is again very important, and that is why people don't talk about it openly, not knowing that this herpes is not the same as herpes simplex. It is herpes zoster. You can talk about it. It is just that your immunity has got weak and it's got activated. It's not sexually transmitted.
Yes.
And
Very
Dr. Sachin, another one thing, because most of the zoster occurs in a covered area, is you see the thoracic dermatome. So they usually they don't tell that. You may have in the thigh, in some area which is covered. So that is another thing. But as a whole, awareness about singles is really lacking.